Hi, and thank you all for joining us today for another CDAPP Sweet Success webinar covering the topic Exercise and the Management of Diabetes During Pregnancy. My name is Tracy Esquivel, and I'm the Project and Communications Manager here at Community Perinatal Network, and I'm also part of the CDAPP Sweet Success Resource and Training Center team. Before beginning today's presentation, I'd like to make some announcements. Firstly, handouts for this presentation were sent out yesterday around 5:45 p.m. I did make the mistake of naming the attachments for the handouts January 2016 rather than January 2017. That was completely my error. So know that those handouts that were sent to you yesterday are in fact for today. I correctly titled those handouts that are in your GoToWebinar control panel. It's again the same exact handouts. I just put the wrong year. Still getting used to the new year. So I apologize for that. So if you registered for this event after I sent them out yesterday, like I just mentioned, pay attention to your GoToWebinar control panel under the Handouts tab, and you'll find them there. Next, please continually check your spam or junk folder, as sometimes our webinar invitations, these handouts end up in there. So sometimes people are worried that they're not getting our emails, but in fact they are in your junk folder. Or just send us an email at cdapp@perinatalnetwork.org, and we can make sure you're getting all our communications. Moving on, if you're watching today with a coworker or colleague, please let us know you are doing so, or else we do not have record that you attended today's event. So if you're on a computer with a couple of colleagues working together, watching this webinar, or in a staff room, that means only one person logged in, and that one person is the only one we have recorded as attending. So do email us to let us know, cdapp@perinatalnetwork.org, the same email that sent you the handouts. And we can add everyone who has watched today's event to our records. Next, our CEU process. 1 hour after the webinar is over, so we end at 1 p.m. Pacific Standard Time, so at 2 p.m. Pacific Standard Time, everyone will receive an email thanking them for attending today's event, if we have that you have recorded, or if we have you in our records as attending. And then it also gives the explanation of how to get your CEUs for today's webinar. There is a link that takes you to our webinar evaluation hosted by SurveyMonkey. It's just a short 13-question survey, and after submitting that, you have to wait 2 to 3 weeks, and we will email your CEU certificate to you. In question 1 of that webinar evaluation, please take your time as we utilize, obviously, your name, credential, and all that specific information directly into your CEU certificate. So please don't rush through that, as we want all our certificates to be accurate. Next, for all the CDAPP Sweet Success affiliates on the call today, which I know is a large majority of you, I want to remind you that the forms for continued affiliation with our program are due in less than 2 weeks. So the due date for those is January 31st, 2017. Your 2017 Memorandum of Understanding and your annual affiliate survey with your 2016 client data are due. I've been sending out communications and newsletters to those who are Sweet Success coordinators for your program, but also they're on our website under the Affiliates tab under Forms. If you have any questions at all, just contact us. Lastly, we'll be holding a question and answer time at the end of this presentation, so feel free to write your questions into us as they come to you, and we're going to get to them as best as we can. Finally, I'd like to present to you our speaker, Lily Nichols. Lily Nichols is a registered dietitian nutritionist, a certified diabetes educator, a certified lead therapist, and a certified Pilates instructor. She has worked at the public policy level with the California Diabetes and Pregnancy Program Sweet Success, worked clinically with hundreds of women with gestational diabetes, and has helped train thousands of medical professionals on prenatal nutrition and diabetes during pregnancy. Lily is also the author of the book, Real Food for Gestational Diabetes, and I know she has an online course about that as well. And this is the 4th CDAPP Sweet Success webinar Lily has presented for. She's a terrific speaker and an excellent consultant on nutrition and exercise, and we are always glad to have her back. Lily, thank you for being here with us today, and whenever you're ready, the presentation floor is yours.
Thank you so much for the introduction, Tracy. Everybody, you can hear me okay, I'm assuming, so I'm just going to go on forward here. The presentation today is all about exercise. As she mentioned, in addition to all the nutrition and pregnancy and diabetes stuff, I have a lot of experience in exercise during pregnancy as a Pilates instructor, teaching pregnant women, and also working with women postpartum. I used to work for a women's physical therapist office teaching postpartum Pilates. So, and in addition to that, I just had a baby last year. So I have some firsthand experience to share with everybody. Hopefully I'll answer all of your questions in the presentation, but do keep track of any questions that come up, and I'm happy to answer them at the end. Okay. So as she mentioned, I'm the author of Real Food for Gestational Diabetes. Also, it's available in Spanish. So if you're curious about my real food approach to managing gestational diabetes, that's a good place to go. As a reminder, this webinar is just a resource but does not define the standard of care in California, even though the information that I'm sharing is all from research studies and from ACOG and whatnot. So keep that in mind. The objective for today's presentation will be to help you understand the benefits of exercise for both mom and baby and some of the specific benefits as it relates to women who have gestational diabetes. We're going to talk about some of the contraindications to exercise during pregnancy, and you'll also walk away being able to give your patients accurate exercise advice. I find often the exercise advice given to pregnant women is kind of watered down, and maybe you've heard some conflicting information about it yourself, so I want to clear that all up. Here's the overview of the talk. We'll kind of go from general to specific throughout the presentation. So exercise guidelines during pregnancy, a lot of prenatal exercise myths, the benefits, precautions, some specific information about diabetes. There's a recent research study on gestational diabetes that I want to go into. How to adjust exercises for pregnancy, what the contraindications are, both the relative and absolute contraindications, how to monitor exercise intensity. This is one I always get a question about, and there's a lot of misunderstanding on that topic. And then I'll give you a list of safe and unsafe exercises and activities so you have that information to share with your patients. So Tracy, I'm ready for poll question number 1.
Okay, hold on 1 second. I'm going to launch it. Okay. I just launched the first poll, and that question is, do you recommend exercise to your pregnant patients? And you are only able to select one. It's yes, no, or sometimes. We'll give you a few or a minute to answer that.
I'm curious to see what the results of this one are.
Looking like most people are saying yes. Okay.
Probably in this group, which is a pretty educated group of practitioners, we're going to have a lot, maybe kind of a skewed results from what we might get just asking, general practitioners.
Very much so, and most have voted, 81%, so I'm going to close it and I'm going to share the results. Do you see those, Lily?
Yes, so 91% of you say yes, you recommend exercise, another 7% say sometimes, so I'm going to count that as 98%, and 1% say no. So
pretty good.
Yeah, that's pretty darn good. And if you're familiar with the Sweet Success Guidelines, then you're probably also familiar that we have a whole chapter on exercise in there. and understand some of the benefits for blood sugar. Alrighty, so we can close off that poll.
I think we go into the next poll, right?
Not quite. I have a few
okay,
slides.
sorry about that. Okay.
At least one slide to go. So
okay.
I'm very happy that 98% of you recommend exercise, or at least sometimes recommend exercise to your clients. ACOG does recommend at least 20 to 30 minutes of moderate, intense exercise per day. On most, if not all days of the week. They always have these like really lengthy descriptions, but 20 to 30 minutes is the goal if they've been deemed, you know, safe for them to exercise in pregnancy. So I'm glad that you're recommending that. Women who have uncomplicated pregnancies are encouraged to do both aerobic and strength exercise before, during, and after their pregnancies. And it's also a really good time to encourage this because pregnancy is usually a time where women are really motivated to make behavior change, and particularly if they've been diagnosed with gestational diabetes. A lot of times they want to do everything within their control to manage their blood sugar and have the healthiest pregnancy possible. There are outliers, but from what I have seen, most women really do want to do the right things. So I'm glad you're recommending exercise. However, about 50% of OBGYNs do not routinely discuss exercise with their pregnant patients, and even more do not advise sedentary pregnant women to initiate an exercise program. And maybe you're in that category as well. There's kind of this fear that if a woman engages in exercise, there might be certain risks she can face if she's not already active. So we'll talk about that a little more. Also, pregnant women tend to naturally reduce the duration and intensity of exercise over the course of their pregnancy. I know even though I'm a pretty active person, that was true of myself. Certain things just became uncomfortable. So if you're, you know, not routinely discussing it with your patients, they might be reducing their exercise even more. Where if they know the benefits, like I'm somebody who's very familiar with the benefits of exercise, even still, I was like, yeah, gonna hold off on that. So that's something to keep in mind. So the role of the provider, you, is to help your patients understand the benefits, give them accurate information. For the women with diabetes or gestational diabetes, make sure they understand how it impacts their blood sugar, set expectations for them, encourage them to keep records. For, you know, women with GDM, they're usually going to be monitoring their blood sugar and hopefully keeping track of what they're eating. It's also good to keep track of their exercise because that can impact their blood sugar control. And then also you want to reassess their goals regularly because the needs for exercise and the types of exercise that are going to work will change at different points in the pregnancy. Okay, poll question number 2.
I'm launching it now. The question is, what types of exercise do you recommend? And please select all that apply: walking, aerobics, strength training, yoga, or other.
Seeing the polls come in, and virtually everybody is saying walking, which is pretty typical. A lot of times that's like the simplest, easiest advice to give. We're at about 80% voted. Let's see if we can get 85 or maybe 90% of you to chime in. I'm very curious. Okay, 85% in. Let's just give another like 20 or 30 seconds here. All right, looks like no one else is voting. I think we can close it off so we have time. I have a lot to cover.
Perfect.
So 99% recommend walking. Aerobics, 38%, strength training, 47%, yoga, 53%, interesting, and other 27%. So that's I'm actually kind of surprised to see such a wide spread on exercise, but this is actually really fantastic. We can close the poll.
Okay.
And, oh, it looks like it brought my presentation back to the beginning. Oh no, here we go.
Perfect.
All right, so I'm glad that you said that because, or answered these questions in that way, because a lot of people are unsure if exercise is safe for the baby, or they're told that walking is the only safe exercise, even though participation in a wide range of exercises, types of exercise is actually important. In truth, exercise is generally not risky for the baby if you're exercising at a mild to moderate pace, and in women who have been deemed safe to engage in exercise in pregnancy by their doctor. And actually there's more positive birth outcomes in women who do exercise regularly. More myths. Maternal exercise will dangerously change the fetal heart rate. Kind of wish I had another poll on this because this is a really common one that I hear even from people who are like pretty in the know and up to date on the research. They're worried that the fetal heart rate will increase or decrease drastically if blood is shunted away from the baby to their working muscles. In truth, fetal heart rate does increase during maternal exercise, but it does drop down to baseline rates when you finish the exercise session. And also it's been shown that stimulating the fetal heart rate, in other words, like allowing the baby to have variations in their heart rate, may actually improve their nervous system development. So it might actually be a good thing that we see some of these slight changes in fetal heart rate. Another thing you'll hear, and I kind of alluded to it in the last slide, is that maternal exercise will reduce blood flow to the fetus. That's actually not true. Because with increased maternal heart rate, your oxygen delivery is actually going to be just fine. Your body can compensate with increased hematocrit, and it also has mechanisms to enhance the amount of oxygen that's excreted. Not to mention you're bringing fresh nutrients, fresh blood, and helping to eliminate waste products as you increase the circulation. So it's actually just fine. So we know that regular physical activity helps improve physical fitness, can help prevent women from gaining excessive amounts of weight during pregnancy, can reduce the risk of gestational diabetes in women who aren't already diagnosed, and also can make them feel well. So there's a lot of general benefits for exercise. Metabolically, we know that women who engage in exercise prior to pregnancy and through the first 20 weeks of gestation, I'm alluding to a specific study, that can reduce the risk of developing gestational diabetes up to 78%. So that's huge. It also helps prevent them from gaining too much weight, as I mentioned. We know that exercise improves overall glucose control in pregnancy. Both fasting and post-meal blood sugar numbers have shown improvement. It can increase insulin sensitivity. It increases muscle insulin sensitivity by increasing the levels of GLUT4 insulin receptors, glucose receptors in the muscle cells. So that's important. Resistance exercise, by the way, is particularly good at that. Women who exercise in pregnancy who have gestational diabetes have shown a lower need for exogenous insulin, meaning insulin shots. So women who are more active may be less likely to require medication to manage their blood sugar, or may require lower doses because they naturally are more insulin sensitive. More maternal benefits is that exercise can help manage blood pressure. It can improve cardiovascular function. It can prevent or reduce lower limb edema, that swelling that can happen towards the end. I remember when I was pregnant, everybody was telling me, like, oh, just wait till the end, just wait till the end, you're going to be so swollen. And it luckily never happened, so I don't know how much I can attribute that to exercise, but it's possible to avoid or minimize that. Also, women who are active or exercise have lower rates of cesarean sections, which is interesting. We know that exercising helps the pregnant body adapt to all the changes that are going on, so increased girth, that ever-growing belly, increased lordosis, which is arching in the lower back. So as the belly grows, it tends to kind of pull your center of gravity forward, and sometimes we compensate by arching in the lower back and also arching in the cervical spine and the neck. So when you exercise, it can actually help your body cope with some of these changes. It also tends to help strengthen the pelvic floor muscles, depending on the type of exercise that you're doing. And studies have shown that physical fitness may impact pushing during labor, although it doesn't necessarily make for a shorter labor. Mental health-wise, exercise helps to lower stress, anxiety, and depression. It's kind of the same thing as if you're not pregnant. You usually just feel really good with, the increased endorphins and such that are released when you exercise. A lot of women find they have better confidence, improved self-image, they can better cope with the bodily changes of your pregnancy. I think it just really keeps you in touch with everything that's changing, and it all changes so fast, so it's important to consider some of these confidence and mental health benefits as important factors. A regular exercise also intends to improve sleep quality, which is fantastic because usually towards the end you're not sleeping so well anyways. For the baby, exercise can help prevent excessive maternal weight gain and help prevent excessive blood sugar levels, which has the result of preventing them from growing too large, so macrosomic babies being too large at birth or having excessive adiposity can help prevent childhood overweight and type 2 diabetes and metabolic syndrome. And also moms who exercise their babies have a lower lifetime risk of cardiovascular disease and cancer, which is pretty interesting. Also, they've shown that there are some brain benefits of maternal exercise as well, that these children have improved stress tolerance and improved neurobehavioral maturation in childhood if the mother was active. There are some precautions, however, to keep in mind before starting exercise. So you do want your patients to seek approval of their doctor to rule out any contraindications, and I'll tell you about what contraindications there are. You do want to assess their current level of physical activity. So were they completely sedentary before? Are they active? Do they walk regularly? Do they stay busy with housework? Do they go to classes at their gym? Are they, full-on like CrossFit level athletes? They need to understand how to modify exercises for pregnancy. They need to understand how to gauge the level of exertion, and I'll talk about something called the talk test, which is a really helpful way to do that, because it is possible to overexert yourself in pregnancy. You also want to know the signs and symptoms to stop. So we'll cover all of that. Specifically for diabetes, the big precaution is that you want to be cautious about hypoglycemia or low blood sugar. So for women who are taking insulin or an oral hypoglycemic agent like glyburide, what glyburide stimulates the production of insulin, the release of insulin from your pancreas. They are at risk for hypoglycemia with or without exercise. But if you add in exercise, something that lowers blood sugar, that can put them at higher risk. So you want to make sure already that they know the signs and symptoms of hypoglycemia. All of our patients should. You want to make sure that they exercise after a meal or snack. So you want to kind of fill up the gas tank before you go for a drive, so to speak. You want to carry your blood sugar supplies if extended activity is planned. So extended activity, by my definition, would be something that lasts more than an hour. Or if you're going to go on something that's like a long hike or something where you're going to be away from medical care or food or something like that. So you do want to have them carry their meter, their lancets, their test strips, carry a carbohydrate-containing snack. If they're really at risk for hypoglycemia, it's helpful to exercise with a partner because they may have hypoglycemia unawareness. They may not know. And also wear appropriate footwear, particularly if we're talking women with pre-existing diabetes. We know that sustained exposure to high blood sugar levels can damage circulation and nerve endings, so they might not have like feeling if they're hurting their feet, for example, and be at risk for developing sores. So you want to have comfortable footwear for that reason. But for women with just gestational diabetes that hasn't been a pre-existing thing, they probably haven't had blood sugar levels high enough to cause any of that nerve damage yet. But still, just for comfort and body alignment, you want to have nice, comfortable footwear. So in pregnancy, hypoglycemia is defined as less than 60 milligrams per deciliter, which for some people that comes as a surprise because outside of pregnancy we define it as less than 70, but pregnancy blood sugar levels tend to run about 20% lower than non-pregnant levels in a normal non-gestational diabetic pregnancy. However, for patients who are super at risk for hypoglycemia or are having symptoms when they're getting close to 70, I mean, that is kind of like an early warning sign, so you may want to, use your clinical judgment by what cutoff level you give to which patients. Signs and symptoms of hypoglycemia are hunger, nausea, shakiness, nervousness, or anxiety. You can read through the full list here. But a lot of these things are things you experience when you've gone, too long without eating, so that's one way to help people understand it. Or if they're just feeling, weak and low energy, that's another really good sign. If there's any concern, if your patients ever have a concern that they're experiencing hypoglycemia and any of these symptoms pop up, you do want to have them test their blood sugar levels. And one of the reasons you have them carry a carbohydrate-containing snack is if they're low, then they have something to bring those levels back up. So treatment for hypoglycemia is to consume something that's going to raise your glucose. So usually simple carbohydrates or pure glucose. You want to check their blood sugar again after 15 minutes. This allows time for your body to absorb the carbohydrates and raise the blood sugar back up. And if they still have low blood sugar, then you want to repeat with another 15 grams or so of carbohydrates. If you're planning to eat a meal immediately, then maybe they don't need to eat another snack and they can go right to a mealtime, but if not, you want to make sure that they bring those levels up. Personally, I think it's challenging when you're chasing like continual or consistent or recurrent hypoglycemia, so you want to help them understand how a balance of carbs and fats and proteins helps to stabilize their blood sugar levels, because it's really not ideal to be in this emergency situation and constantly be treating lows with extra sugar that's unnecessary. So you do want to help them understand that, but have them know that what's going to raise their blood sugar the quickest in one of these emergency situations is going to be something that's very sugary. So these are some examples of a 15-gram or so carbohydrate snack that they could use to raise their blood sugar. The raisins are really helpful, or any kind of dried fruit would be really helpful if they're exercising, because they can just leave it in their bag or put it in their pocket or something while they're going, and it's an easy one. Or glucose tabs, of course, would be an option. This study that I want to mention, because everybody gets so concerned about hypoglycemia that I think when you start going into exercise education and then make a beeline for talking about hypoglycemia, some women can get scared away from engaging in exercise. And really I want to point out that, unless they're on blood sugar lowering medication, specifically glyburide and insulin or insulin, they're probably not going to be experiencing low blood sugar, and usually the problem we're dealing with gestational diabetes is hyperglycemia, not hypoglycemia. So you do want to encourage them to actually exercise, because there's so many benefits, just to keep some of those symptoms in mind. And in fact, this study, a randomized controlled trial, was done on women with gestational diabetes I want to mention this study specifically because there's only been 9 prospective studies done on the effects of exercise in gestational diabetes. 7 of them were on aerobic exercise only, and 2 were on resistance exercise. And this is the first that looked at combined therapy of aerobic and resistance exercise on gestational diabetes. And also it looked at like a pretty significant amount of exercise. So in the exercise group, the intervention group, they did brisk walking 30 minutes a day and structured exercise twice a week. And that was one-on-one with a physiotherapist. This was done in Europe, so they call it their physical therapists physiotherapists. They had 20 minutes of aerobics on a treadmill. They had 20 to 25 minutes of resistance activity targeting all the major muscle groups. And then they had a 10-minute cool down with pelvic floor exercises, stretching, and relaxation. So it's a pretty significant amount of exercise, I think, for this type of study. But they showed that the exercise group had significantly improved postprandial blood sugar levels. Their fasting blood sugar levels were also better, although it didn't reach statistical significance. And there were no adverse side effects. There was no hypoglycemia. This group of women in both the control and exercise group, however, were not on blood sugar lowering medications. But this is just in women with diet-controlled gestational diabetes doing a fairly significant amount of exercise, and there was no hypoglycemia whatsoever. So this is a pretty interesting study for you to take a look at if you want to, just published in the past year. In average, their blood sugar dropped 16.6% from the beginning to the end of the exercise session, if that's something you want to keep in mind. Okay. So, adjusting exercise for pregnancy. Like I mentioned, the center of gravity shifts forward in late pregnancy as the belly grows. And for a lot of women, that can cause their low back to arch too much, depending on how in control of their posture or how aware of this they are, and that can cause a lot of low back pain. The breasts also enlarge, and that can lead them to kind of round forward and hunch their shoulders and give them pain in their middle or upper back. Also in late pregnancy, your lung capacity can be physically limited by the baby and the uterus pushing up. So there's a lot of things that you need to keep in mind when you're exercising. If you maintain good posture, often that means you're sitting up taller with a slight engagement of your abdominal muscles, and that can help ease the stress on the low back. If you stretch the chest muscles open or allow yourself to hold your chest in an open, not a hunched position, that can kind of ease some of the pain in the upper back. And then you want to exercise at a comfortable pace so they don't run out of oxygen. So naturally, most women are going to do this, but they may need that reminder from you. This is a picture of a friend of mine that I have in my book. So she was here, she was just past her due date, like by a couple days, so over 40 weeks. And I had her demonstrate bad posture and good posture. So on the left, you can see that she's allowing the weight of the baby to just pull her forward. So her belly is just hanging out. Her low back is arching. She's hunching in her upper back. Her chin is kind of like jutted forward, so there's arching, overarching in her cervical spine. It's just uncomfortable. And I remember when we were taking these photos, she was even saying like, that hurts my body, like that hurts my back, and that hurts my neck. And then in the other picture, she's standing with much better posture, so she's aligned her ears over her shoulders, over her ribs, over her hips, over her knees, so she's in a good, stable center of gravity. She's slightly pulling in on her belly. I mean, she literally looks less pregnant, and she's not closing in on her chest. So this is something that, you know, when I was working clinically one-on-one with pregnant women, I would sometimes like have them like work on good posture even as they were sitting and talking to me, because if they're complaining of back pain and like, oh, it's hard to breathe, and they're just completely hunched over, I mean, that's part of the problem. Another thing we want to worry about is joint laxity. So there's a surge in a hormone called relaxin, and relaxin is a hormone that helps relax the ligaments and tendons. So it can, I mean, it's there for a reason. It's there to help prepare the pelvis for birth because things need to stretch out, of course. However, what I found kind of surprising going through pregnancy myself was just how quickly you can feel the results of or feel the effects of relaxin. And especially for women who are already tend to be on like the flexible side of things so they can hyperextend their joints. I mean, you're really at risk for injury doing certain types of activity. It can make jumping or exercises that have sudden twists and turns with sudden starts and stops more likely to jar your joints or cause some sort of an injury. I remember personally my hips were like especially unstable, so I had to be really careful on like the types of terrain that I was hiking on. I was a pretty avid hiker ahead of time, so that was kind of annoying, but just something that you have to do. It can make women who do like heavy weightlifting, you just want to be really cautious with, well, not only for your joints, but for your pelvic floor is a separate thing, but for your joints, you want to be really aware that you're not hyperextending and then damaging your joints. So back or hip pain, like I mentioned, potential balance problems can be an issue. And it can also be a problem with high impact activity. So women who run, they may notice at a certain point that it becomes uncomfortable, and it's okay to have them ease up on that type of activity and do something more low impact to protect their joints. So some things that can help are to avoid stretching outside of a joint's normal range of motion. This is something to really keep in mind with yoga practices that do things like really deep lunges or like leaning forward to stretch your back. Activities like that can be a little more dangerous. Practicing stabilizing and balance exercises are really good. Pilates, which tends to focus more on strength versus pushing your limits with stretching, as some forms and some teachers of yoga can encourage, can be helpful. Engaging your abdominal muscles appropriately, so a slight drawing in and up of your belly. So when you're pregnant, it's like kind of feeling you're holding the baby in close or pulling the baby in closer to your spine can be helpful. This can also help prevent diastasis recti, or the separation of the rectus abdominis muscles. And then strengthening the pelvic floor can be helpful to stabilize your sacroiliac joint, which is right where your hips and your spine come together. A lot of women are unfamiliar how to strengthen or engage their pelvic floor, or may do them incorrectly, so it should feel like a lift, not a bearing down. Squats are also really helpful in just functionally strengthening the pelvic floor muscles, and you're kind of in a position where you're not over-tightening them, because that can be another issue. I really encourage people to work with a women's physical therapist or a pelvic floor physical therapist if they're unsure on all these things. Adjustments for exercise in late pregnancy, you want to avoid extended periods of time laying on your back, because the weight of the baby, depending on how the baby is sitting, can put pressure on the vena cava and can impede blood flow, so that's no good. If you're feeling kind of lightheaded after laying on your back, that may be your sign that you're at a point in your pregnancy where you don't want to do exercises lying on your back, and maybe you just want to do them slightly reclined or propped up on your elbow or pillows or something like that. Avoid exercising in hot weather, because dehydration is more common in pregnancy, and it's also much easier to overheat. You have this little heater inside of you, so bring water, take breaks when needed. It's just really important that they listen to their body. Wear comfortable and supportive clothing and gear, and ideally exercise with a partner. So when it comes to contraindications for exercise, there's both absolute and relative contraindications. Absolute contraindications are ones that can cause a life-threatening situation and must be avoided. So typically a woman experiencing any of the following has already been told by her doctor not to exercise, or maybe in an extreme case she's been told she's on bed rest or partial bed rest. So these would be signs that you don't want to exercise, that it's unsafe. Relative contraindications, however, mean that caution should be used. So it's acceptable to exercise if you have extreme morbid obesity, because the benefits outweigh the risks. However, you want to have certain precautions in mind. So this is something where you want to just talk to the patient's doctor so they can kind of define where their guidelines are, what's safe, what's not, how much, how long, signs and symptoms to watch out for. Because clearly somebody who is very overweight can benefit from some exercise, but they're not going to want to do every type of exercise under the sun. Or somebody who has a history of an extremely sedentary lifestyle. Walking for a few minutes might exhaust them. So you want to set your goals at a much different level. Warning signs to stop exercise for any pregnant patient would be anything coming out of the vagina, so bleeding or leakage of amniotic fluid or suspected leakage of any of those things, shortness of breath prior to exertion, dizziness, headache, chest pain, muscle weakness, calf pain or swelling, preterm labor. The sensation of decreased fetal movement is also something that they want to be aware of and get checked out. For intensity, everybody always asks about heart rate. There's actually no recommended safe or maximum heart rate during pregnancy. It hasn't been studied enough for them to set a level. However, a lot of people do say a maximum heart rate. It's not an evidence-based guideline. So the best way to measure exercise intensity is actually called the talk test. It shows a close correlation between all of these other measures of exercise intensity that are really fancy, that involve you needing to be in an exercise lab with hooked up to all sorts of probes and whatever. So the talk test is free and easy. It's very easy to explain for your patients, and it's accurate. So the goal of the talk test is to maintain exercise at an intensity where you can maintain light conversation. So if you're exercising, you want to talk to your exercise partner, maybe recite a nursery rhyme or your ABCs, and if you can quote talk the talk while walking the walk, you're exercising at an appropriate intensity. It's okay if you need to take a breath or so. It's not like you can't have your heart rate go up. It's okay for your heart rate to go up a little bit. You just don't want it to be struggling to catch your breath. So if that is the case, then you want to slow down, catch your breath, and just exercise at a slower intensity. And personally, I find most pregnant women are not really pushing themselves that hard where they're running out of breath. They need to know that some of this is like a normal adaptation to pregnancy, so it's okay. And they need to understand, what can be problematic and what is not. But most of the time I find pregnant women are trying to get away with not exercising. Safe aerobic exercise would be things like walking, swimming. Swimming is really fantastic, especially for women who are heavily overweight, because it just takes some of the load off of their joints. Is comfortable. Stationary bike. They say stationary bike versus an actual bike because there's a risk of falling, but personally for women I've known who are cyclists and are very comfortable on a bike, I think it's fine for them to continue just as long as they're cautious about falls and biking on busy roads or something like that. Elliptical machine if they have access to a gym, step aerobics, moderate hiking I did a ton of. Running and jogging is something that you just want to give the okay on with some caution. Generally it's considered safe if a woman has been running or jogging pre-pregnancy, but it does put a lot of strain on the joints. It puts a lot of strain on the pelvic floor. So if they find that they have urinary incontinence or their knees are hurting or their hips are hurting or something like that, they may want to dial that in, dial that back. Dancing, a lot of types of dancing, climbing the stairs, those are all safe. Strength exercise would include things like lifting weights, using resistance bands, stability balls, prenatal Pilates, and certain types of prenatal yoga would be okay. Of course, you want to talk about the risk of overstretching. Hot yoga or any type of exercise class done in a hot environment would not be safe. There's already that risk of overheating and dehydration, so discourage that. And also any type of strength exercise that's done, if women are doing it with good body mechanics and good form, they're more likely to save their joints and prevent some injuries. So do encourage women to work on their posture, because that can make or break the benefits of exercise. And ideally with strength exercise, they recommend 2 to 3 times a week, where with aerobic exercise, they're usually aiming for a little bit every day, 20 to 30 minutes a day. Contraindicated exercise, there's sort of 3 categories that they fall into generally. Things that risk abdominal trauma, so a lot of exercise that is played with balls or contact sports. And I will give the caveat that if you're like, I don't know, playing really low-key soccer with your kids, like it's probably fine, but if you're playing soccer with people who kick really hard, you know, that's something you want to keep in mind. Activities that can risk falls could be contraindicated, so gymnastics, downhill skiing, things like mountain biking, those are generally not recommended. Exercises that have excessive bouncing or jerking. It's funny reading through this list, having like gone through a pregnancy, it's like, oh God, I would never want to do that activity. But you never know. Sometimes women do really want to, you know, go mountain biking, and even though that might feel uncomfortable to somebody else in pregnancy, somebody might be all for it, especially if they're really into, you know, really into exercise or whatever their leisure activity is. Some exercise resources that can be helpful, check out the ACOG website. They have a really good review on exercise in pregnancy, both for providers and patients, that you should check out. And in summary, exercise education should include about 30 minutes of exercise a day. You could say 20 to 30 minutes if a woman does not have medical or obstetric complications. It should include both aerobic and strength exercise. And with a few modifications, there's many different forms of exercise and activities that are safe during pregnancy. These pictures are of me during my pregnancy. So I think the one on the left, I was probably in my 2nd trimester, and the one on the right, pretty sure I'm in my 3rd trimester by that point. I did quite a bit of hiking during my pregnancy, and I kept up with Pilates, and it really helped me stay pain-free and comfortable and keep things pretty low risk. So highly, highly encourage exercise in pregnancy. Just encourage your patients to pay attention to their body and adjust exercises as needed. So in summary, exercise is safe and effective for most pregnant women. Make sure their doctor rules out contraindications before beginning a prenatal exercise program, but for the most part it offers a lot of benefits to mom and baby and a lot of specific benefits to gestational diabetes. And beyond this, I think the rest of my slides are just references. So I am open to questions for the remaining, looks like 9 minutes we have left.
Perfect. Thank you so much, Lily. I'll jump right into questions. We have a couple so far. Feel free for all the attendees still on the line to continue to write into us, and we'll get to them as best as we can. The first one is, do you know why blood sugars run lower in pregnant women?
Yes, so insulin production generally goes, there's a lot of theories, so I'll go through some stuff first. Insulin production triples by the 10th week in pregnancy in a normal pregnant woman without pre-existing diabetes. Who knows what happens if there's pre-existing diabetes. And a lot of that is to try to counter the effects of physiologic insulin resistance that hits in the later stages of pregnancy. There are hypotheses on why blood sugar levels run lower in pregnant women. Some of it is that even mildly elevated blood sugar can increase risks dramatically for the baby. So I don't know if you saw a study out of Stanford, I believe it was 2015, that looked at risks of congenital heart defects in women with elevated blood sugar, and they showed significantly higher risk in women with slightly elevated blood sugar, meaning these are women who didn't meet the criteria for gestational diabetes, so even like tiny, tiny elevations. And when you look at average blood sugar in healthy pregnant women, there's an article in, I think it's Diabetes Care from 2011. They looked at average for healthy pregnant women, normal weight, normal glucose tolerance. The average fasting blood sugar was about 70. Plus or minus 8, meaning a lot of women within those first two standard deviations actually had fasting blood sugars in the 60s or maybe the 80s. And after meals, average blood sugars were between 99 and 109. Plus or minus, I don't remember the standard deviation. But it's just a fact of life that blood sugar is meant to run lower in pregnancy. So that article I mentioned from Diabetes Care actually questions our current targets for blood sugar cutoffs in gestational diabetes, because we know a lot of women who are meeting those targets are still at risk for some certain complications. So long-winded answer, but
yeah, no, that was really thorough and good. Next question. This is a tough one too. Can you give a metabolic explanation for why BG will rise after exercise in type 1 diabetes mellitus and how to avoid this?
So type 1 diabetes is a little bit tricky. So there have been some studies that have shown that like liver glycogen can be, you use up the available glucose and then the liver is stimulated to release glucose to bring those levels back up. But there's something to be said for, exercise is a stressor on the body in some cases, and usually it's meant to be a beneficial stress, but I think when you can push it to a certain threshold, some people will experience high blood sugar. I don't have the perfect, most of what I work with really is gestational diabetes, and there's actually very, very few studies on type 1 diabetes and pregnancy that I can speak to. So I don't have like exact physiologic mechanisms like that I can throw out at you. I'm sorry.
That's totally okay. Another question is, do you have any comments or thoughts on water aerobics?
I think those would generally be great during pregnancy. A, you can get the heart rate up. B, you can reduce the heavy load that gravity has on you, and you're already lugging around this big belly everywhere. And it turns that aerobic exercise into resistance exercise as well, because you're usually like pulling certain things through the water or moving your limbs through water adds resistance. So I think that would be fantastic. A lot of YMCAs offer water aerobics.
Great. There were 2 attendees who asked a very similar question about should pregnant women avoid core ab exercises? Is it important to do them during pregnancy, or should they be avoided? Another person asked, can you do planks or crunches or oblique twists? So all having to do with core.
Okay, so this is one that I'm glad that this question was asked. There has classically been a recommendation to avoid certain core exercises during pregnancy because they may make it more likely for women to develop diastasis recti, or separation of the abdominal muscles, separation of the rectus abdominis, which are the muscles that run vertically from your ribs down to your pelvis. So I think we just need to give a caveat with this. Personally, I think abdominal exercises are important to do during pregnancy because it's almost like, how women often wear like belly binders or like belly support in pregnancy to try to like hold up the belly. I mean, we have muscles that wrap all the way around from our lower back all the way to the front, called our transversus abdominis, that are meant to be that girdle. So I think if you're doing core exercises, if you do them with the intention of engaging the appropriate muscle groups and not overusing the rectus abdominis, I think they are fine, and I think they're beneficial, and they help with back pain. And I can say that from working one-on-one with pregnant women, consulting physiotherapists on this, and experiencing it firsthand in my own pregnancy. Exercises like planks can be challenging to do with really good form unless you already have strong abdominal muscles, strong transversus abdominal muscles. A lot of women only activate their rectus abdominis when they're doing it, in which case you're only strengthening the muscle group that runs vertically, which is the muscle group that naturally gets separated in pregnancy anyways. So that's probably not the ideal core exercise for the vast majority of pregnant women, at least once you're at the point where your belly is really expanding a lot. Crunches, again, are a type of abdominal activity that tends to overstimulate the rectus abdominis. They're not ideal, but I think that they can be done with better form and can be okay. I will say that a lot of Pilates exercises and the way that they are taught tend to encourage engagement of a lot more than just your rectus abdominis, and so those can be a helpful place to look for safe abdominal exercises. A lot of things that are typically done on the back, like crunches, could be done in a semi-reclined position, like leaning back on your elbows. And a woman can literally look down at her belly and see, you know, if it looks like her belly is bulging up or like tenting up, that's a sign that you're only engaging the rectus abdominis. If she instead focuses on trying to hold the baby in close to her spine, then she better engages her transversus abdominis. So I'm not against them. I'm like pro-abdominal exercises with caution, with proper instruction, with proper form.
Great. I think we have time for just one more quick one. If fasting blood glucose values are slightly elevated, does a 30-minute walk help this, or does it lower it?
Generally, a 30-minute, it depends. So usually exercise does have an overall beneficial effect on blood sugar levels as a whole. The studies that have been done on pregnant women with gestational diabetes have shown mixed results. Some of them show exercise doesn't have any effect on fasting blood sugar. It definitely has less of an effect than postprandial blood sugars. However, there's other studies that have shown that it does improve them. So I say give it a go. Do encourage the 30-minute walk and see. I've been like blown away sometimes by the simple changes that a woman makes and how much it affects her fasting blood sugar, and for other women, you know, not so much. But typically the effects of an exercise session can last in some studies up to 24 hours, the effects on blood sugar numbers. And so we may see that carryover effect happening for fasting blood sugar, but that number is just the trickiest one to get a handle on. So encourage the exercise with the possibility that their fastings may improve, but no guarantee.
Lily, thank you so much for your 4th webinar with us. I love how you answer the questions, how you give your presentation. We always love having you. We really appreciate, too, this topic, and as you've mentioned throughout, it's so important to encourage this. So thank you for your time and your expertise and for sharing with us this presentation.
You bet.
And with that, as we're right at the 1 o'clock hour, maybe 1 or 2 minutes over time, I want to thank everyone for attending today. Don't forget that in 1 hour you will receive an email regarding the steps of how to get a CEU certificate by taking the webinar evaluation. Thank you all for joining us, and have a great rest of your day. And with that, I will end our January 2017 CDAPP Suite Success webinar. Thank you so much.